What global guidelines exist for colon cancer screening frequency? Have you ever wondered about the best practices for colon cancer screening? Understanding the global guidelines can help you stay informed. Colon cancer screening is crucial for detecting precancerous polyps and early-stage cancers, ultimately reducing mortality rates. While specific recommendations can differ from country to country, there are common principles that many health organizations share. Most health authorities recommend starting routine colorectal cancer screening between the ages of 45 and 54 individuals at average risk. This screening usually continues until the age of 75 or 80, depending on a person's overall health and life expectancy. The frequency of screening often varies based on the type of test used. For instance, the fecal immunochemical test or guaiac-based fecal occult blood test should be done annually or every 1 to 2 years. Flexible sigmoidoscopy is recommended every 5 years, while a colonoscopy is typically performed every 10 years if the initial results are normal. Some guidelines suggest a quart colonography or virtual colonoscopy every 5 years as well. For individuals with higher risk factors, such as a family history of colorectal cancer or personal history of inflammatory bowel disease, screening may need to begin earlier, often at age 40 or younger. These individuals may also require more frequent surveillance. If findings reveal adenomas or polyps, the screening intervals may be shortened. Different organizations provide specific guidelines. The U.S. Preventive Services Task Force recommends screening from age 45 to 75, with personalized decisions for those older. The European Society for Medical Oncology and many European countries suggest starting at age 50, with colonoscopy every 10 years or fecal tests annually. The World Health Organization supports population-based screening programs, generally endorsing fecal tests and colonoscopy as primary methods. In South Korea, national programs recommend annual or biennial fecal blood tests starting at age 50, with colonoscopy for positive results. Practical considerations play a role too. Screening frequency needs to balance the effectiveness of early detection with the risks of invasive procedures and available resources. Non-invasive stool-based tests are often preferred for initial screening due to their accessibility and safety. Colonoscopy is usually reserved for follow-up or higher-risk individuals. Staying on schedule with screenings is vital for effectiveness. Public health efforts focus on education and access to ensure people can get screened. In summary, colon cancer screening guidelines generally suggest starting between ages 45 and 54 average-risk individuals, using stool-based tests annually or biennially, and colonoscopy every 10 years if results are normal. Higher risk groups requiring earlier and more frequent screening. Personalized medical advice from healthcare professionals is essential to tailor screening frequency to individual risk profiles and health status.